With it getting harder and harder for healthcare professionals to deliver basic services at the operating table, politicians can't come to an agreement on how to fix the healthcare system around the negotiating table.
I want to mention now, I guess, the elephant in the room, or in this case, the elephant not in the room.
A total breakdown in talks, the federal health minister and provincial health ministers unable to agree on establishing a Canadian health data and health human resource strategy, or agree to a meeting between the prime minister and premiers, even leading to staff hauling away a podium, cancelling a joint press conference.
Before the meeting was even over, before our discussions on these two essential items were even concluded, the premiers released a statement calling the meeting a failure. That is not exactly what we would call meaningful engagement.
We are going to succeed in this because our cause is right, because Canadians support that cause.
Right now, the federal government contributes about 22% of healthcare costs. The province would like to see Ottawa's share go up to 35%. Stuck in the middle of all this are those looking to receive healthcare and those trying to provide it.
I think they would see this as a lost opportunity and be wondering where the failure lies.
Healthcare needs help.
There are calls from nurses to listen to their prescription for hope, streamlining the immigration and credential process to lure internationally educated health professionals, provide retention incentives, including strengthening mental health support for healthcare workers, and better collection of staffing data to understand those health workforce shortages. And even with a sense of political frustration, the talks have shifted away from service delivery.
We are going to continue to work with whoever wants to work with us, and that includes the federal government or anybody else.
Premiers keep insisting on money and the First Minister's meeting. Once again, I will be very clear. Before we start talking about the means, we need to talk about the ends.
And with health ministers warning this will be a difficult winter on the system, a lack of a deal, leaving those looking for health care in the cold. Richard Zussman, Global News, Vancouver.